Hi, my name is Dr. Puneet Ralhan, and I'm one of the attending physicians here at Desert Spine and Sports. I started my journey out at Desert Spine in 2019 as one of the fellow physicians. When given the opportunity to stay on as an attending physician, it was an absolute no-brainer for my family and I. It's been one of the most rewarding experiences for my wife and I to raise our young family here in the Valley. From a professional standpoint, Desert Spine has been like no other place that I've ever worked at before. I have spent most of my professional career working in various different hospitals and clinic settings all throughout Chicago and New York, and I can truly say with utmost confidence and pride that the moment I stepped into Desert Spine, it felt like home. One of the biggest lessons I have learned as a young physician throughout my career thus far is that people's lives, people's health, and their functionality doesn't improve always with the latest and the greatest technologies, but things that people value the most is time with their provider, time with their physician. That time is equally valuable to us as physicians in order to fully evaluate the patient. In order to appropriately come up with a good diagnosis, it requires us to sit with the patient and listen to their ailments, listen to their complaints, listen to the full history to be able to fully examine them and correlate that with appropriate imaging is what helps us come up with appropriate diagnoses. And I can truly say that at Desert Spine and Sports, I have the privilege to spend that appropriate amount of time with patients. Too often in my career, whether it's me as a patient on the other side of things, my family or my friends or my other patients have gone to various facilities and clinics and they have felt either too rushed or that a set amount of time was allotted for that patient in which there wasn't an appropriate amount of back and forth for the physician-patient relationship. And here at Desert Spine and Sports, we strive to be different. We strive to be better, and communication is a big pillar of one of the most important things we try to do here as a team. That being said, being up to date and keeping up with the latest technology is very, very important to us here at Desert Spine and Sports. The fellowship program where we train future physicians in musculoskeletal, sports, and spine medicine helps us do exactly that. I have no doubt that when I look back at my career one day towards my retirement, there will have been a big change in how things are done and the data that comes out and the standard of care that's performed. However, I do strongly believe that it is important for us physicians to provide changes and adapt to things in a very safe and effective way. Not all new research that comes out is great for patients or is fully matured to be acted upon. And here at Desert Spine and Sports, through our regular monthly journal clubs and attending didactics, we do just that to keep up with the latest research that is going on and scrutinize it at the highest level in order to provide better care for our community. Having, like I said, worked in Chicago and New York, I have had the opportunity to work with some amazing communities, and the Valley has provided another such awesome experience as well. I have the classic athlete in high school or Division I college, or even some pro athletes that I have the privilege to treat. But at the same point, I have the non-traditional athlete in my 95-year-old golfers that golf, two buddies that love to golf still once a month, or the new mom that is, constantly taking care of her newborn baby with very repetitive mechanisms, or the dad that just loves to play soccer with his kids on the weekends, or the heavy laborer that is very activity intensive with different things that they do in their craft and their work. The definition of the athlete has changed in our society, and I have the honor and the privilege to be able to work with so many different people in different capacities. And it truly is a rewarding experience to watch these people be able to improve their quality of life and function as they strive towards a better self. That is one of the biggest tenets of our specialty, physical medicine and rehab. Our job as physiatrists is to provide and maximize conservative management that is non-surgical. We like to use non-opioid based functionality to improve the quality of care. And we strive to achieve that in many different ways. And it's a very individual approach based on the individual and their underlying issues and concerns. So Desert Spine and Sports overall has provided me with the platform to be able to perform good quality medicine with appropriate time with patients. I hope to continue to serve our community and provide that quality care overall. If you or anyone you know would be a good fit for us or have any other issues that you think we can help you with, please contact us and set up an evaluation to see if you're a good candidate for further treatment. My favorite types of patients at times are those that come in from a preventative purpose sometimes, to learn about the mechanisms of the spine and the lower back and the neck to help prevent future injuries and ailments. As we all know, we are constantly using our body in different ways. So our goal here at Desert Spine and Sports is to provide the best care that we can for our community in the best way possible. And I look forward to continuing to do so. Thank you.